Hi, I'm Craig Radnay, and I'm a board-certified orthopedic surgeon with additional advanced fellowship training, specializing in knee reconstruction and sports medicine, as well as foot and ankle reconstruction and trauma. From a very young age, I was always attracted to medicine for the ability to try and help people and try and make people's lives better. From my own personal experiences with medicine as a youth and as a child, I was more involved with orthopedic surgery. And I tested myself throughout my studies when I was younger, and in the end I was drawn to this as a profession to really be able to help people and get people back to their regular lives. I think my training makes me unique in my field in the sense that I did extra advanced training, not just in the field of knee reconstruction, sports medicine, but also in foot and ankle reconstruction and trauma. And so for that reason, I'm able to offer my patients more of a continuity of care when they have multiple issues. And also, since all the joints and all the bones are in essence connected, I think that I am able to have a wider perspective to help treat many different conditions. When a patient comes to see me, it's typically because they're having some type of pain or problem with their knee, ankle, or foot.
No.
And how about when you wear shoes?
Some discomfort.
Does that hurt you at all? It's my job as their doctor to help figure out why they're suffering, to diagnose it, and then to try and recommend a treatment plan specific for that patient and diagnosis. Patients are much more involved in their healthcare nowadays, and it's critical that they should be involved. And so I spend a lot of time with each patient making sure they understand their diagnosis and treatment plan. Every patient is different, as are their expectations, so each treatment should be tailored to that individual patient. I will always have a full discussion of the non-operative and surgical options to try and heal the patient, but also to allow them to return and maintain an active, pain-free lifestyle. For some patients, that might include some type of shoe modification or bracing. For others, it might also include some combination of medication or injection. For some patients, I might recommend a tailored physical therapy program. And for other patients, sometimes even the conservative treatment might be surgical intervention. I discuss all options with patients in detail, and I try to combine cutting-edge technology and modern techniques to provide my patients with the best orthopedic care possible. And in between is where a polyethylene spacer goes. This is the plastic spacer, and this allows you to then regain the motion of the ankle. These are the ligaments here that can help stabilize the ankle from side to side to make sure it's stable. I use minimally invasive open and arthroscopic techniques to minimize downtime and immobility and try to maximize patient recovery and return to activity and sport. So even though I'm a surgeon, I love to do surgery. Surgery is really always the last resort. So I always make sure that I discuss all the options with all of my patients so that they understand not just their diagnosis, but also what the options are. Every person is different, and so each individual has an individual diagnosis, but also an individual treatment plan. And while sometimes surgery is the conservative option, by all means we discuss all treatment options. I think that in medicine, anytime you're treating patients, you're involved in a relationship with your patient, and the decisions are not made in a one-way street. So certainly you have to communicate with your patient. Every patient has a unique story. Every patient has a unique injury. And while patients can share a similar diagnosis, the way that they get there is usually unique. And so it keeps everything interesting in terms of learning from your patients, but also going forward to get the best result. You really do have to work with your patients, and that involves not just your patients understanding what you're describing them, but also making informed decisions as to their care, because in the end, they're going to be the most invested in getting a great outcome for their illness. Certainly, when patients come in and are told that they will need surgery, there's a lot of fear and apprehension involved over the procedure, the immediate recovery, and their long-term function. It is my philosophy and that of my team to make sure that patients understand all aspects of their care, but also to know that we are here for them around the clock to make sure that all of their needs are being met. We also discussed what the patient's goals are to make sure as a team that we and the patient are working towards something together. And this starts in the office, before the surgery, when we spend a lot of time discussing the risks and benefits of a procedure and the preoperative planning and post-surgical recovery. This continues when I see the patients after surgery, in the recovery room, and in the hospital, and with phone calls that I make to their home. It's Dr. Radnay calling. Yes, I'm calling with the results of your MRI. How are you feeling? My office will also help facilitate all aspects of treatment, help coordinate rehabilitation, and help manage post-operative care. I see patients back frequently in the office, starting 7 to 14 days after surgery, then usually every few weeks thereafter, all the way out to 1 year, to make sure that we can follow a patient's progress closely, to make sure that we achieve the best possible outcome. In the end, the greatest satisfaction that we can receive is seeing a patient recover and be able to return to their active lives. I and my team will be involved with the patient from the start of the care to the end to do our best to ensure the best possible result.